I feel dizzy.
Whoa, I've got you!
Oh my God! What's happening?
That short clip you just watched now is not real. That is an AI generated video to explain what can happen to someone with a very low blood pressure or hypotension. In this video, I will explain what hypotension is. I will explain what causes hypotension. I will explain the signs and symptoms that shows that somebody is having a hypotension. I will also explain some of the home treatments for hypotension. And at the end, I will list the common medications doctors usually prescribe for a chronic hypotension. Hypotension in this video means the same thing as low blood pressure. So don't be confused. Just in case you are coming across my video for the first time, my name is Paul, a licensed pharmacist practicing in Lagos, Nigeria. I am an online health educator. I educate people on various social media platforms, on Facebook, on Instagram, on WhatsApp, and now on YouTube. Please, if you are just coming across, make sure you subscribe and click on the notification button so that each time I drop a video, you'll be among the first people to know. So now let's go to the basics. What is hypotension? Hypotension simply means low blood pressure. It is the opposite of hypertension. It is defined as a blood pressure reading below 90 over 60. The 90, that's the upper one, also known as systolic blood pressure, over 60, that's the lower one, known as diastolic blood pressure. If you check your BP and it is reading anything below 90 over 60, it is defined as a low blood pressure. But hypotension is not just about the reading, it is about how you feel, the symptoms you are having. Some people can have blood pressure around 90 or even above 90 over 60, and they're already having signs of low blood pressure. Some people can even faint when their blood pressure is reading above 90 over 60. Some people can have low blood pressure below 90 over 60, yet they are completely fine. So the best way to define hypotension is how you feel, not just the reading. That reading is just a figure. The most important thing is how you feel. In the next clip, I'm going to describe some of the symptoms of hypotension. That's how to know if somebody is having a low blood pressure or not. It's not just about the reading alone. These are 5 signs that somebody may be having a hypotension or low blood pressure. The first sign is feeling of dizziness. If you're always feeling dizzy, it could be a sign that your blood pressure is low. This happens because the blood flow to the brain is not sufficient, so it makes you feel dizzy. Another sign is chronic tiredness or fatigue. Even when you are not doing anything stressful, you always feel weak or tired. You don't feel that energetic. It could be a sign that your blood pressure is low. The third sign is blurry vision. Yes, low BP can actually affect your sight. It can make you see double at times. So if you are having a blurry vision, it could be a sign that your BP is low. You should go and check your BP. The fourth sign is blackout. This usually happens if somebody wants to stand up, or sometimes even when you are walking, everywhere will just feel black. That could be a sign of low BP. The fifth and probably the most important sign of a low BP is feeling like fainting or even fainting. If somebody fainted or somebody is complaining that she feels like fainting, it could be a sign that the person's blood pressure is very low. I once had a staff in my pharmacy that fainted. So when we revived and checked her BP, it was reading 60 over 55. That was very low. So in this video, I'm going to explain what you can do if you are always experiencing any of these signs I just mentioned, and especially if your blood pressure is constantly reading below 90 over 60. Before we talk about the treatments, let's look at some of the common causes of low blood pressure. One of the most common causes of low blood pressure for many people is dehydration. Dehydration simply means not taking enough water. Yes, this simple act of not taking enough water causes low BP for many people, especially during hot weather or people that sweat a lot. When the blood volume is low because of low fluid intake, the overall blood pressure is going to drop. So for many people, taking enough water can actually prevent low BP. Also, hormonal imbalance can cause low BP for both men and women. I hope you know that men also have hormonal imbalance. There's a hormone known as cortisol. When this cortisol hormone is not sufficient, your BP can be low. In fact, one of the medications for treating low BP works by helping your body to produce more cortisol. We'll come to that later. Also, some people have natural low BP, like it is just like that in their gene. Their BP is naturally low. And for those people, most of the times they don't feel the symptoms, they don't feel this, they don't feel like fainting. It is just natural low BP. Another common cause of low BP for some people are medications or combination of medications. Some medications for high blood pressure can cause low BP, especially when you take them in overdose. Some sex enhancing medications like Viagra, sildenafil can cause dangerous low BP. Sometimes when you combine medications like ciprofloxacin with sildenafil, it can cause dangerous low BP. Combination of ciprofloxacin and Cidalu, that's tinizadine, can cause low BP. There are many possible causes of low BP. On the treatment of low blood pressure, I've actually discussed the non-pharmacological approach, that is treating low BP without medications. I discussed that on my Facebook posts. I will drop the link to the post in the comment section. You can check the comment section, go to the posts and read. I think I listed about 7 options. And if you have any question, you can drop it under that post or here on YouTube. I will respond. Some of the key options I mentioned in that post is by using ORS. You can get a sachet of ORS mixed with a bottle of water and be sipping slowly, especially when you are having the signs or when your BP is reading below 90 over 60. Then another option is using a compression stockist. Compression stockist is a special type of stockist designed to compress the blood vessels in your leg. This helps to raise your BP. You can get it from pharmacies or buy it online from online stores like Jumia, Konga, many of them. It is very effective. Now, let's go to the medication aspect because that's actually the main aim of this video. At this point, I want to remind us that this video is for educational purposes only. Please don't self-medicate. As a matter of fact, out of the 5 medications I will mention here, 3 of them are infusions, 3 of them are drips that should be given by a healthcare professional, preferably in the hospital. Okay. Also, don't forget to subscribe. I will be dropping more educational videos like this. When you subscribe, you will get notified when I drop a video. There are different medications for low BP, but in this video, I will mention only 5. Out of those 5, 3 are infusions. The first one is normal saline. Normal saline is a drip that contains sodium chloride, that is salt, and water. It is usually administered when somebody is having low BP or after reviving someone that fainted to boost the blood volume and the BP. If normal saline is not available, Ringer's lactate can be used. Ringer lactate is also a drink that contains sodium, potassium, and lactate. It also helps to boost the BP and the blood pressure. If Ringer lactate and normal saline are not available, dextrosaline can be used if the person is not diabetic. Dextrosaline contains glucose and sodium in addition to the water. So any of these 3 can be used if somebody that fainted has been revived to boost their blood volume. Apart from the infusions, there are tablets or injections that can also be used for low BP. But these medications are prescription drugs that should only be used when prescribed. Also, they are used preferably for chronic low blood pressure. The first one is hydrocortisone. It comes as a tablet or injection. Hydrocortisone helps the body to produce cortisol. Remember what I said about cortisol, the hormone. that helps to raise the BP. It is used to treat low blood pressure. Another one is fludrocortisone. It also belongs in the same class with hydrocortisone, but this one helps your body to retain salt and water. It does not boost or it does not help your body to produce cortisol hormone. So this is the end of this video. If you learned something, make sure you share this video.